Hi, I'm Dr. Paul, and welcome to another episode of Ask Your Pediatrician. Our topic for today is SIDS, Sudden Infant Death Syndrome. So sudden infant death syndrome, or crib death, has to be one of the most devastating. I can't even begin to imagine what my parents who've had to go through this have had to go through. It's unspeakable. And so in honor of any of you who have lost a child to sudden infant death syndrome, or SIDS, I wanted to share this video to get out there at least a few pointers on what we can do that might decrease the chance of this happening to our babies. So in 1992, the Academy of Pediatrics made the across the country declaration of the Back to Sleep program. I think prior to that, in my generation, I was put to bed on my tummy. And in fact, babies around the world are often sleeping in all sorts of different arrangements. But in this country, the decision was made based on some research that showed less SIDS, less crib death, if babies were put to sleep on their back rather than on their tummies. And indeed, within a few years, we had a 30-35% drop in the SIDS rate. The program was a huge success, and to this day, the research verifies that there is benefit to having your baby sleep on a firm surface on their back. Now, for you to kind of envision this, just think about putting your baby face down on a beanbag. Now, if you might imagine that beanbag is going to smother, entirely occlude their airway. And when you're a newborn, that first few months of life, the more immature you are, the less your brain gets the signal, turn your head and breathe, or lift your head and breathe. You just sort of fade off. And there you have SIDS. At least that's one of the causes. Now, mind you, we don't know all the causes because it's a syndrome, which by definition means we don't know the causes. But we do know that smothering can cause your infant to die. So anything we can possibly do to minimize that, we should do. Your baby should sleep on their back. It should be on a firm surface. Now, I know there's a huge controversy about, co-sleeping in bed. I'll just say this. It's okay if, and there is a big if, you've got to have a firm surface in your bed if your baby's going to be in bed with you. They do sell co-sleepers now where that baby has got their own little space. They can be on a firm surface on their back right beside you, or the co-sleepers that saddle right up to your bed. I know if I was a nursing mom, I'd want my baby right there. Who wants to get up, walk down the hall, in the middle of the night? But make sure you're doing it safely. I remember when I had my first baby, probably the most delightful thing for me as a dad was to have that baby on my chest just sleeping, and we would just spend hours like that, and it was wonderful. Now, in my case, they were face down, right? Well, back then I was a little slimmer, so it probably was okay. There wasn't a lot of fatty tissue where I was going to have that baby face down. Think of the beanbag analogy, smothered. But those of you who maybe have a little extra tissue, body fat, body weight, or nursing moms where perhaps just that breast could get across there, just keep your baby up high if you're going to be kind of hanging out together. If they're going to be face down on your chest, it's a wonderful thing to do, but you want them in a safe place in case you fall asleep, for example, and that way they can't smother. On the smothering aspect, I had a tragic case in my practice where a cat went into the baby's bassinet, slept right on the baby's head, and they came and found the cat and the baby, and it was too late. So that's rare, but keep those cats. They like warm things. You'll find them always cuddled up anywhere where it's warm. Keep them so that they just can't get to your sleeping baby. A few other things that will help you avoid SIDS, sudden infant death syndrome. You don't want it too hot, believe it or not. Now, we don't want our children freezing and shivering because they're going to lose so much heat that they don't gain weight when they're neonates, newborns. But you don't want to overheat your baby either. That's been shown to be associated with sudden infant death syndrome. So keep the temperature, in the 70, 75 range. If you have to have it hotter, then don't bundle your baby up. If it's really cold, obviously, babies all over the world in igloos and everywhere else survive just fine. You have to be reasonable in how you keep them warm. The other factor that's definitely associated with SIDS, sudden infant death syndrome, is smoking. Now, folks, if there's any one health thing you can do to improve the health of your family, it's don't smoke in the house, period. Smoke has a high amount of methanol. Our body turns it into formaldehyde, huge toxin. It's just horrible in so many ways, but it's also associated with SIDS. So if you must smoke, just go outside, even if it's freezing, and you're doing your family a huge favor. So those are the main points. I know I haven't touched on every single point, but I wanted to touch on the highlights, and wishing you health and obviously no SIDS in your family. Thank you for watching. I'm Dr. Paul.